Welcome to another How Healthy Are You weekly educational podcast. My name is Dr. Thomas Brewer. I'm a PhD chemist and nutritional blood microscopist. For today's podcast, I'm going to be talking about two topics. One is a true 100% cure for diabetes. It's all diet related. And the other topic is about kombucha tea, and this is really tailored for those of you that drink a lot of kombucha tea. So the first one is about a special diet, very well known, that absolutely cures diabetes. Now, I have talked about this to people when I look at their blood and they tell me they're diabetic, and I explain this study, and I finally found the study again so I can refer to it more directly instead of indirectly. And this is something that we don't hear about. And I'm sure nobody on this call, on this podcast, has ever heard about this way to absolutely 100% cure diabetes. I attribute this to suppression of healing information because it does not include drugs or actually anything other than vitamin B12. That would be the only supplement one would need. So all food-based. So the diet is known as a macrobiotic diet, macrobiotic. So what that means is all a person eats, and this takes about 6 months to completely cure diabetes. No need for medication in 6 months, and often much shorter than 6 months. So whole grain carbs and vegetables. So this is a very high carbohydrate diet. It is not about the carbohydrates. It's about the type of foods, the sources, which is similar to what I've said in my carbohydrate hierarchy video that's on my YouTube channel. I talk about carbohydrates being from certain foods, and we can't demonize them just because they're carbohydrates. This is just bad science, bad information. It's really a lot of propaganda. So the diet is mainly brown rice, barley, millet, that would be your whole grain carbs, and vegetables. That's the diet. That's the food source. Green tea is the common drink. What has happened is it severely and consistently reduces blood sugar in diabetics in just a few weeks, but total cure in 6 months for 100% of the participants. So one thing that was thought of is the reason it works so well is these whole grain carbs and vegetables really help the gut microbiome, because animal-based products tend to hurt the gut microbiome, in fact, even worse than antibiotics. But that's only part of the picture. What's really going on is the animal-based protein sources are very hard on our kidneys. They create a lot of acidosis, which we'll get to when we talk about kombucha tea. But this acidity and this damage to the kidneys is what makes the diabetes so severe and increases blood sugar levels, and this sugar cannot get to the cells, and it can't cross the membranes for the cells, so the sugar and the insulin builds up in the blood. So typically, when one wants to test whether you're a diabetic or not, you look at a marker called hemoglobin A1C. Sometimes it's just called A1C. So we want numbers around 5%. That's considered good. You're pre-diabetic when you get 6 to 7%. And if your A1C is higher than 7%, you're considered a diabetic. Well, this test started with people over 12%. These are severe diabetics. They're very high in the diabetic range, and they were all taking insulin and other medication. Within 6 months, all of them were in the 5% range, meaning none of them were considered diabetic anymore. And by the end of the cycle, by the end of this 6-month trial, they weren't even taking any medication. They were not taking insulin. Now, this sounds incredibly surprising, and that's why it's not shared with the public, because it would eliminate the need for a lot of medication out there, and people would be a lot healthier. The only thing one needs to do when you eat this way is you need to supplement with B12. Another good side effect of eating this way is everyone's LDL cholesterol dropped an average of 20%, and their fats, their triglycerides also dropped over 20%. Now, this is a huge amount of carbohydrates. Their diets were about 73% carbohydrates. So basically 3/4 of their diet was carbohydrates, yet the diabetes went away. Conclusion here, it's not the carbs, it's not the carbohydrates, it's actually the animal protein that's causing the trouble. I have always advocated that as we age, we should consume less animal protein. Enjoy yourself when you're young, but as you age, start decreasing your animal protein. So a question comes up is, okay, I do this, I do it for 3, 4, 5, 6 months, my diabetes over, now what do I do? Because you're going to want to get back to some animal protein. And my recommendation is keep it very low, and you know how to heal or cure yourself should it get bad again. But that's all it takes. Now, this study was done in 2014, and have you heard about this? Because this is really shocking information. A 100% cure for diabetes done with food, no drugs, no medication, and the only supplement is vitamin B12, and that's really for anyone that doesn't eat animal-based products. Another question that comes up, people ask me, am I vegan? Am I vegetarian? Do I eat animal products? Well, I do. I do eat animal products. I have diminished my consumption over the years, and as of now, I'm not diabetic. Should I become diabetic, I know exactly what to do. Okay, the next topic is about kombucha tea, and most of you have heard about kombucha tea. You can buy these in the store, and there's a huge problem with the consumption of kombucha tea. And what happens in sporadic incidents, people become acidic. The term is lactic acidosis. And this happens in a consistent but sporadic number of people. And the question comes up, well, why are we drinking this? Well, there's numerous extravagant and actually bogus claims. Now, listen to these. Kombucha tea is purported to cure cancer, to reduce blood pressure. Here we get some weird ones. Fight acne, relieve arthritis pain. How about this one? Eliminate wrinkles. Here's an even better one. Restore gray hair. Yet there's been no clinical studies. They've all been anecdotal evidence that refer back to each other. They're all internet-type studies. And even all the way up to 2019, there's been no data on humans. It's all related to rats and things like that. So there's absolutely no science. There's no justification to consume kombucha tea for any health claim. Now, if you like it and you feel good when you drink it, or you're assuming that it's high in probiotics and you want that probiotic benefit, well, go ahead. But my conclusion is, from the lack of data, I do not recommend a lot of kombucha tea consumption. It is a bit of an alternative as a probiotic source, but I do not recommend consuming kombucha tea on a regular basis. Okay, so that's all for this week's podcast. Thank you for listening, and as always, please don't keep me a secret.